Do you want me to keep the mask on or take it off? Okay. Okay, awesome. It's hard to breathe and talk. Awesome. Well, let me come back here. Is there a clicker? Do y'all know, or do I just need to tap it? It doesn't, I can stand right here. It's okay. Thank y'all so much for having me here today. It's such an honor to get to participate in the Research Brown Bag and get to share the work that I was really invested in during the 2 years that I was in school. So thank y'all for allowing me to be here today. So without further ado, I want to share with you my passion, which is working alongside directors of nursing. So my project is titled Director of Nursing Turnover, Intervening with a Long-Term Care Leadership Roundtable. So a little bit about the background and kind of how this came to be. There is a big issue in Lubbock, Texas, with turnovers of DONs. And when I say DONs, I mean directors of nursing, in case there's anybody that isn't aware of that term. But there's also a need for DONs to really feel valued in their role. And there is a need for transparency and support in that role. And because there is such a high turnover, DONs are not able to have that. And with this project, developing this roundtable, what we have found is that directors of nursing are able to communicate and collaborate, share ideas with each other in a non-judgmental, supportive, non-hierarchical manner. And that's kind of how this roundtable came to be. I really wanted to develop something that allowed directors of nursing to come together where they could share issues and feel supported and valued. So the problem, throughout my research, I found that 40.8% of directors of nursing actually remain in their current position for less than a year. And that's a travesty. And I thought, man, we've really got to get to the bottom of why this is such an issue. And an estimated 60% are only in their position for about 6 years or longer. So I got to thinking, man, what's going on? Why is there such a problem? So, and I'll get to that when I get into the discussion. But through the literature, I found that turnover really does lead to poor outcomes for patients. When there is instability within the workforce, within that facility, and the DONs are leaving, it does lead to poor quality of care and poor outcomes for these patients. And as I mentioned, that high turnover does equal lower quality of care. So the aim of my project, the aim of this roundtable, was to establish a nurse leader roundtable to address issues related to turnover of DONs in long-term care, and to identify interventions to increase retention and recruitment in facilities in Lubbock, Texas. So as I dived into the literature, I found a lot of interesting things that really helped to support and answer some of these questions as to why the DONs were turning over and why they were leaving. So some of the information that I found showed that, like I said earlier, that turnover rates do affect quality of care. There was a big emphasis on the demands of the role that DONs have. And I don't know if any of you are a DON or are in close contact with a DON, but the demands of that role are extreme. They work very long hours. A lot of times they can get called into work in the middle of the night. They have very little support from the higher leadership. So it's just a very, very demanding role. And so I saw a lot of that in the literature. When we look at professional support and retention, the professional support is lacking for these directors of nursing, for these DONs. Oftentimes in this role, they are working in silos. The only time that they hear from leadership is when there's a problem. And it's not when it's a good thing. So they are often isolated and not communicating and fellowshipping with other DONs. The other thing is retention. A lot of DONs are new nurses that I found, and they are often put into the role of a DON because they are a registered nurse. They get very little training, and that transition to that role is very difficult. And so we see a lot of that turnover because of that. They're ill-prepared. And so that kind of led me to the role transition, the importance of that role transition on retention. We've got to train these DONs. We've got to give them proper leadership training and the support and resources that they need. Some ethical considerations related to my project were sensitive topics, and I made sure that during my roundtable discussions that we kind of upfront discussed the fact that there may be some sensitive topics that would be discussed. It would remain in confidentiality. So I really wanted to kind of lay the foundation for this is a trusting environment. I want you to feel like you can open up and share what you're going through, share your issues. So confidentiality and then voluntary participation. The DONs, it was completely voluntary that they come to these roundtable meetings. And I did not have to get QIRB or IRB approval for my project. So the conceptual framework that I used for my project was the logic model. And it's really just a graphic representation of the different stakeholders and the inputs that I used, the different activities that allowed me to progress through this project, and the desired outcomes. So now to the fun stuff, the design. So my project was program development and implementation. So I want to preface with there was very, very little information in the literature about nursing roundtables. It's really kind of a new thing. And so what I was starting and establishing for these DONs was novice. And so what I did, the first thing I had to do was identify the 15 long-term care facilities in Lubbock, Texas. I pulled that information off the DADS website, the Texas Department of Disability and Aging Services website. So I got the list of the facilities. It was a tedious process at first, but completely worth it. Once I got the facilities, I had to call each facility because they do not disclose on that website who the directors of nursing are, and probably for the reason of the fact that they're always changing. So I called the facilities. I sometimes would get a name for a director of nursing. Sometimes it was, we don't have a director of nursing at the time. We have an interim director of nursing right now. It was challenging to get a hold of a director of nursing. So I got the list of the DONs that I could. Once I identified the list of DONs, I developed I created an invitation. I really wanted to make a personal invitation and hand deliver those to the DONs because they didn't know me from Adam. So once I created this invitation to this first meeting, I hand delivered it, met with them, visited with them briefly, told them what I was doing, and then had to decide on when this first meeting was going to be and when the subsequent meetings were going to be. And developed the agenda for the first meeting, and then kind of discussed the plan and the agenda with the DONs. So we had our first meeting in October of 2019, which now seems so far away, or so long ago, but first meeting was in October of 2019. followed by November, December, and January. So we had 4 meetings in total. And we'll talk more about that in just a minute. So my method, my actual intervention, was this nurse leader roundtable. And so as you can see here, my 4 meetings. So at that very first meeting, I really wanted to kind of just get to know the DONs. We had some icebreakers. We just had this open dialogue and discussion of what the primary issues were in the facility. We then had the November, December, and January meeting, and at those meetings, I had 4 structured questions that we discussed at those meetings, and I'll talk to y'all about those here in just a second. Okay, so after the first meeting, I wanted to get an idea of who attended my meeting. So I developed a demographic survey. I had 5 DONs in attendance, and I looked at age group, education, the years they had been in RN, years in long-term care, and years in their current position. And some did not complete the survey. As you can see, I had some missing. But what's interesting is that, if you can see, I don't have a light or anything, but right up here in this top right, 60% had only been in their position for 6 months to a year. So I had some newbies in this group. And I actually only had 1 that had been there for over 5 years. So this qualitative analysis, this data that I collected, was done through these 4 structured questions that I developed. And we did this through an exploratory focus group. And the 4 questions are outlined here. The first question, I looked at what were the greatest challenges that the RNs were the DONs were facing. The second one was I wanted to look at, on a day-to-day basis, what challenges did they feel like they faced and that interfered with their ability to accomplish their job as a DON. Third, I really wanted to look at the resources that they felt like they had available to them on a day-to-day basis, or what resources they felt like they needed. And then question number 4, what support do you get from your executive administrators? So, got through all the questions, we got through those 3 meetings, and I got into all this, the data analysis, and I pulled out some themes from the 4 structured questions. So 4 themes emerged, as you can see up here. CNA staffing issues were a big one. Regulatory burden, demands of the role, and leadership. So those were the 4 themes that emerged from this exploratory focus group. All right, so theme 1, I want to spend just a few minutes on that. Some of the responses that came out of this that supported the theme. DONs reported that CNAs just not showing up to work. That was a huge problem for them and really added a lot of stress to their job. CNA patient abandonment. I really had no clue that CNAs were doing that in long-term care facilities, but apparently throughout this project, it's a big thing. There's not a lot of loyalty to the facility. The CNAs, it might be mid-shift. They'll just up and leave the facility. Come to find out, there might be another facility down the road, and they start working there the next day. So CNA patient abandonment was a huge problem among most of these DONs. A lot of them had several CNA positions that they could not fill, and they were having a lot of trouble filling. And so, as you can imagine, if they don't have the CNAs to do the work, the DON has to step in and do that. And so that's just one more thing that they've got to add to their list. And then last but not least, there are a bunch of agencies here that are hiring from the same pool that these long-term care facilities are hiring from, but the agencies pay a lot better, and the long-term care facilities just can't compete. And they really expressed that that was just a big concern, and they can't fill those positions, they can't pay the CNAs, then, what do you do? So that was our first theme. The second theme was the regulatory burden. Like I mentioned earlier, they are just inundated with so much on their plate every day. Well, then you got state that just shows up out of nowhere for a survey, and they are expected to drop everything. And that can mess up a whole day that's planned. So forget about getting anything done. They constantly feel like their license is being targeted. In long-term care facilities, that's the DON, everything rests on that DON's shoulder. And so if they get written up for something, it's on the DON. So they just had this constant pressure that, if I mess up, there goes my license. And so a lot of them were like, it's just not worth it. I'm gonna go find a job somewhere else. Another one, I feel like my license is always at risk. And then just trying to accomplish education on various competencies. It was always changing. Like, what do I have to educate my staff on? Now something new's come out, I've got to educate them on this. So just trying to keep up with the ever-changing competencies for their staff. Theme 3 was demands of the role. They are mentally done at the end of the day. They need more time to get all their stuff done. A lot of them, one mentioned that they just need 30 minutes, if they could have 30 minutes of quiet time in a day, just to decompress, it would do wonders. And then another one said, there's just gotta be a better way for us to prepare for this job. It's what's going on right now and how we're doing is just not cutting it. And then theme 4 was leadership. One response was, I'll say it again, retention is directly related to the DON and administrator. DON and administrator satisfaction is related to CEUs. This one DON basically said, if I don't get along with my administrator and my staff doesn't get along with me and we're not working in harmony, it's just not gonna work. So I thought that DON painted a pretty good picture about the relationship that needs to happen with DONs and leadership. One DON said that they just want leadership to trust in their decisions and trust that they're capable in their role of getting their job done. Some felt like it was a constant micromanaging, and that's, that was all that they came in to do. Make sure you're doing this, make sure you're doing this, did you do, So just this lack of trust. I mentioned earlier, I only hear from leadership if there's an issue. That's really discouraging. And then that expression of, I'm pretty much on my own. So once you're in that role, you really don't get that support from leadership that you need. So once I went through all the questions, did my data analysis, I sent out a post-nurse leader satisfaction survey at the end of the meetings. I really wanted to get a feel for how the DONs felt about the meetings. Was this a benefit to them? So the first question asked, I believe the meetings have been beneficial and they are of value. And 75% were in that agreement that they felt like the meetings were of benefit and had value. The second question, I would recommend this meeting to other nurse leaders. 75% of the DONs that were there said that they would recommend the roundtable meeting to other nurse leaders. The third one, I plan to continue coming to the meetings. 75% said, yeah, I'll be there. I plan to continue coming. And question 4, it is important that I can meet and network with other leaders. 75% said absolutely. And I can tell you guys, as you know, when you've invested so much and you see this is why it's worth it. You know, when you see these kind of results. I also added in some open-ended questions. I really wanted to just kind of get their thoughts. So The first one, in your own words, please describe any benefits you perceive from attending the meetings. One said that change in perception is powerful. Only seeing the topic at hand from inside the bubble limits our ability to adapt to situations. Networking with similar facilities helps change perception. I thought that was so powerful. The other one, just getting to know other leaders and being able to discuss common issues and how they handle them. You know, it was so neat to see these DONs. They're like, oh, you deal with that too? What are you doing for that? You know, and for them to just not feel alone. It was so heartwarming. And then being able to collaborate with other nurse leaders. How can the meetings be improved? I didn't get a lot of response on this one. I had one just say, I've only been to one meeting, not fair of me to judge this yet. So I appreciated the honesty there. What topics would you like to see presented at future meetings? One said education. And another mentioned how to improve antibiotic stewardship, conversations with providers. So I'll kind of talk about that at the end with this education piece. The last one, do you have any additional comments or feedbacks? I attend when I can get away. Please keep in mind that there are things that are out of our control and I may not be able to attend every meeting. State walks in the building and the DON can't leave the building when they are here. And I had several that told me, you know, if state's there, we can't leave, we have to be in the building. And then the last one, thank you for giving me an opportunity to learn from other talented people in our community in such a powerful way. And I just thought that was so neat to read. So I did have some limitations with my project. The first one was participation. As I mentioned earlier, out of the 15 long-term care facilities, I was only able to get 5 DONs to attend. I tried really hard, throughout those months to get more. It was really hard to get in contact with DONs, but their time constraints, their schedules. I had several that were out of town for trainings. Some were brand new DONs and just did not feel comfortable leaving their facility to come to a 1-hour lunch meeting. The other was turnover. Turnover was a limitation. During my project, out of the 5 DONs, one had been a DON for 3 months. She actually left her facility and went back to floor nursing. And come to find out, just at the finalization of my project, one DON had just reached the year mark, found out that they had left their facility and is no longer a DON. So, I mean, turnover is real, and it was happening during my project. And, when that's happening with DONs who are part of your project, you're thinking, man, it's real. So in conclusion, I just want to add that I think this roundtable has really shed light on the need for DONs their need for this networking, this need for collaboration, this need to feel connected. As nurses, guys, we need to have that. And it's not fair that they don't get that. And then, that connection, that collaborating that I mentioned, being able to discuss common issues, having a network of other nurses that they could just pick up the phone and say, hey, what are you doing about this issue? Are you dealing with the same thing? And then that leads me to the last point, which is educational presentations. One of the things that we looked at the end was, as issues start coming up, we looked at doing 20-minute presentations during our lunch meetings for topics that the DONs wanted to hear about. Trying to bring in, experts on the topics or whatnot, but maybe it was antibiotic stewardship or, something related to the CNAs, and doing quick educational presentations about 20 minutes. So, and that is all I have for you guys, and these are my references, and that's me. And any questions?
I have a few, but I'll
Sure.
Yeah.
Thank you.
she'll be 92, and she was in one of the long-term cares that Priscilla was, the DON was participating with. And I can say, like, just because, you know, you get close to the DON, the state comes out during this pandemic and they say, okay, XYZ on the news, the governor comes out. So then you've got all these hopeful families who think, oh, I'm going to get in and see my loved one. The DON is pouring through pages and pages of all the things they have to do. So not only is that DON having to deal with that, she just has all these families that are upset. Right now what we're going through is they were my mom, I've changed her to a different facility. They already have their second dose. Now what?
Yep.
Am I supposed to get it as well? You know, and is that going to allow me to come in? And no one knows. They haven't thought that far, you know, and it's always no one knows.
Right.
And the director there is always telling me, thank you so much for being so understanding and so encouraging, because that's not what we're getting from the general pop. And I think that's what I was going to ask you. Where are y'all with this pandemic and being able to meet and be supportive? Because I know it's got to be hard.
It is so hard. So, you know, so y'all all know the pandemic hit in March. So I had my last face-to-face meeting in January of 2020, because I was finalizing everything for school, and I did my presentation for school in April, but the pandemic hit in March. And with the guidance of my advisors, we thought about, you know, let's try Zoom. Let's try to do a Zoom meeting. And I was a little bit hesitant about that, because during the face-to-face meetings, the DONs really expressed that, you know, this was their one time to get out of the facility. They got to eat lunch, they got to be face-to-face and network. And so I was a little hesitant about, you know, how is this gonna work? How are they gonna feel about sitting behind the computer? I had one tell me that if they go in their office and they have their door shut and they're on a meeting, that's an open invitation to knock on the door and be interrupted. So that's why they really enjoyed being able to leave for an hour for the day. So I tried my first, so I did my presentation for school in April, graduated in May, had my first Zoom meeting with the DONs in May. I had one person show up. And I was heartbroken. But we talked with that one DON, and of course, you know, asked this DON, you know, how's it going in light of COVID? What are you doing? And we tried to make the most of that meeting, but you know, it's a little awkward when the meeting is for the DON and other DONs. So we kind of did some thinking, and we thought, you know, maybe we just need to kind of put it on hold right now. These DONs are so overwhelmed, and we could really sense that from this DON. I mean, burdened and overwhelmed with everything going on right now. So we thought, you know, we're just going to put it on hold right now. So I have some ideas. What we're wanting to do is try to develop, so kind of taking off of this leadership roundtable, trying to develop some sort of advisory council with, if I can find some DONs in Lubbock that have been in their role for maybe 2 years or longer, and see if they would be willing to be some sort of an advisory council that we could form that would really help to kind of bring in these younger DONs and work with them. And that's kind of this next step that I want to go with this, you know, because I feel like this kind of set the foundation, but I feel like we can do so much more. The problem is just finding DONs that have been in their role, that know their role, and so that's kind of where we're at right now. It's kind of been at a standstill with COVID. And I honestly don't know if many of the DONs that I worked with are even still in their roles and working at the facilities. I know 3 of the 5 are no longer. So it may be a whole brand new bunch. Yeah.
Did you come across any much information on that actually we have numbers for what kind of outcomes are put at high risk by that turnover? Because the lack of continuity of care, I would think we're really putting that population at high risk. I mean, the DON is at risk, but the people that are entrusted to their care
Absolutely.
would probably have major gaps.
I didn't focus so much on that number, but more so the turnover number. That where I got that that information was the long-term care nurse staffing survey, where they look at, you know, turnover in long-term care facilities. They look in the hospital settings. But I bet you I could go back. It would be really interesting to see, you know, what, I mean, it is devastating to patient outcomes. I mean, it's devastating to the nurses that work there. You know, when the DON's leaving, they're like, okay, well, we've got another DON. Now I got to learn to trust this person now, and, you know, job satisfaction decreases. You know, there's lack of innovation. The research showed that, you know, there's very little innovation, but no motivation to come to work. You know, that lack of trust. So, I'll go back because I'm interested too in you know, what is that number for, you know, patient outcomes. But that's where I got a lot of that research, was that long-term care nurse staffing survey. Thank you for asking. You bet. Yes, Dr.
I just
Harrison.
have a comment. I was hopeful when all this pandemic stuff started that it would really focus a light on all of the deficits in our long-term care facilities, because we had such tragic losses and such a horrible thing. But it's almost as if what's happening now is, you know, we're like, you know, ADHD kids, and squirrel comes along, something else comes along, and everyone's focus is off of that, which is so unfortunate. But during this time, while we still have a little bit of focus, it's so important to put a big spotlight on it and say, look, this is what's happening. So I'm wondering if who knows about this? Do our city council know? Do our medical community, are we aware of this? Are the physicians that are working in these facilities, do they know what's happening and what the impact is? And so I think that a lot could be done. It's just reining it in and getting to the people that might be able to facilitate that.
I agree. That's such a
I
good
think
point.
you did a great job.
Thank you.
I'm so proud of you.
Thank you. Thank you.
One more question.
Sure.
Does anybody else have their hand up? I don't want to. Do we know what it costs to, the churn costs? Is it the same as if, you know, I think Fern, what does it cost when you lose a nurse in a year and you have to hire another one?
Oh yeah,
Is
like
that
the training and orientation.
60,000?
60, 80,000,
60
yeah.
to 80, I would think it would be
I would
even more.
imagine it's comparable, if not more, for a DON.
So that's another huge investment.
I mean,
where
yeah.
that's just money's just
The
going
loss
out
that they're
our healthcare
incurring.
system.
I mean, like the one that was there for 3 months. I mean, just the process of going through and hiring and training. I mean, like I said, they don't really get a whole lot of training. They go to some general class, and that's about it. But once they're on the facility, they really don't get to shadow a DON. The literature talked about, pairing up the novice DONs with a mentor DON, but really that just doesn't even seem possible either. So there's just got to be a better way to, get these new DONs in, give them the proper training and guidance. But long-term care is hard. And COVID has not made it any easier. And it's not the glamour job that our students want to go into right out of school either. That's not where they're picking to work. And I know, that's my love. My love is geriatrics, and I try to shed light on, they need great nurses too. It's not just the ICUs and the pediatrics. So I agree with what you said. Really, really getting this out there and getting it into the right hands, I think would help.
Thank you for what you've done.
You're so welcome.
Start an inroad there because
Thank
it's
you.
a great job.
Thank you. Yeah.
So in your group, you mentioned earlier that the longest one in your group was 5 years. Was that from just the 5 that continue to come, or was that from the 15?
So
I'm just kind of curious. What is the average length of stay, I guess,
Right.
if you want to, of that here. I mean,
So that was out of
Curious.
the 5 that I had coming. One had been there for a little over 5 years in her position, but they aren't really out of that facility for 5 years. That one DON had kind of hopped from facility to facility. So that's a problem in itself too. Yes, she's been a DON for greater than 5 years, so I could have gone a whole nother direction with this. Yes, there's turnover among DONs, but then they're leaving their facilities. Out of the other facilities that I was not able to get in touch with the DON, they had an interim DON. I could never get the DON to call back. It was really interesting. I would call some of the facilities and ask to speak to the DON, and I would get some pushback. They would get real defensive. May I ask who's calling, or why do you need to speak to them? And so I would introduce myself. Well, she'll have to call you back. And I mean, just hang up. I wouldn't get to give my name. So this happened on many occasions. I could never get, so I had to go through many hoops and ladders to try to get just even a name for a DON. And I had some that would tell me they would show up, and I was all excited. I had like 8 one time that were supposed to be at a meeting. And, a no-show. And that was another thing that was really interesting. In our profession, we expect this level of professionalism and, a phone call or an email, hey, yes, I told you I was going to be, I didn't, none of that. And so I just a lot of interesting things that kind of came about throughout this project. I don't know if it's just they're so stressed and so overloaded, and I had one that was in meetings every day on the day that I picked, because I just had to pick a day and stick with it. So it was the 4th Thursday of every month for those 4 months. And some were like, well, I can't do that, I'm in meetings all day. And there was other reasons why some couldn't come, but
I think the 5 you got to be pretty regular was.
I thought that was an accomplishment. Yeah, I was like, I got 5. I'm doing okay. So, any more questions?
I think it's just the bare tip of the
I
iceberg.
know, just barely peeling off that Band-Aid just a little bit.
This is a lifetime of research.
Yeah.
This is your whole career right here. And there's so many different aspects of it. And I think finding other people to work with you, it's really hard when you're out there doing it alone, but finding people that are like-minded, that really have a passion for geriatric populations, and working together in a team would probably be very helpful to you, and help generate some, the next
Ideas,
step.
yeah, absolutely. Well, I
I think-
appreciate that.
I think that if a hospital could buy in on the concept and see the profit of, many of these patients are not Medicaid. I mean, that's a consistent income from Medicaid, but a lot of them are private pay, and we were paying $8,000 a month. And so if they could see that that's income, if they could have the same level that Byrne has as far as staffing, and then I think you would probably have the quality there.
Yeah.
But I don't think hospital administrators see that as an income that they could have, and also have a healthier population.
Right.
And I also saw the CNAs and the MAs, medication aides, they fight. And so the MA feel like they're above the CNA. And then the CNAs are usually our incoming students.
Right.
And so they're there 2 weeks and out.
Yeah.
They've done, they get their clinical and
They're done.
They're done. And so, and then you have the crossing of your staff. And then, like you said, the DON, she can't fight to have her numbers, and, it's a mess.
Yeah, and it's everywhere. It's not just in Lubbock, Texas.
Oh, yeah.
I mean, the literature, this is a problem nationwide. So I just focused on, and that's another thing I wanted to say. I eventually would like to take this, beyond Lubbock. But in order, I actually, one of the facilities was Slayton Care Center, but I could never get that DON to come to the meetings because she said it was just too far of a drive for her during her lunch break, which I understood. And I had some say, oh, I can meet after 5. And I'm like, oh, I can't do after 5, But I eventually would like to tie into some of these smaller, Denver City and, Littlefield, where they've got long-term care facilities and they're dealing with the same issues. And so just go from there.
Very, very good.
Thank you.
Good job.
Thank y'all so much for having me.
Well, no, that's it.
That's it, yep.
All right. Well, thank you all so much.